Myoliner TMJ therapy. There's a lot of reasons that we could need to do TMJ therapy. It might not just be clicking or popping or discomfort directly in this joint. It could be due to headaches. It could be due to neck pain, shoulder pain. Headaches is actually one of the biggest causes for it. But what people don't realize, what that popping and clicking and grinding and these different sounds that our jaws can make sometimes, is as the bone, the lower jawbone, moves against the upper jawbone, there's a disc there. And sometimes that popping in and out is the disc actually popping in and out of the socket there. And that causes detriment to the bone. So the bone, this bone that goes into the jaw here, is supposed to be round. So it's rounded. And what happens is when you're in a pathological position, when that jaw is misaligned, like in older forms of orthodontics, and still some current forms, where they push your jaw backwards, it can jam the bone into the back of the other top bone, and it can cause remodeling over the years of constantly opening and closing via chewing and talking and all the things that we do with our mouth. It can cause flattening of this bone that comes from the lower jaw. And that can be very detrimental to the joint. So what does that look like on a CT machine, a CBCT, where we see this in 3D? See how flat this individual's condyle is here? And then you can see it from a different angle over here. Instead of this being round, like a circle, it's actually flat in two different planes. It's flat here and it's flat here. And if we come back over here, you see how flat this is here. Now, why is Myoliner so beneficial for something like this? Because when we put you in the proper position, using a functional orthotic, essentially, it can what happens in the joint is something called bioremodeling, where that joint and that area of bone can actually reshape, not necessarily back to 100% of its original form, but it can reshape to a more healthy form for the bone and the joint, and therefore relieving much, if not all, of the patient's symptoms.